Welcome to the OBR Interactive Case Study Series. In this case study, Drs. Sameh Mikhail and Tanios Bekaii-Saab discuss the second-line treatment of colorectal cancer in a 49-year-old male. Patient's characteristics included
This is a 49-year-old male who presented initially with abdominal pain, fever, and night sweats. He had a CT done that showed a mass in his right lower quadrant. He underwent a right hemicolectomy. Pathology showed a T3 N0 high-grade adenocarcinoma.
Patient's treatment history included
He did not receive any adjuvant chemotherapy. 1 year later, on surveillance CT scan, he had 2 peritoneal masses. Biopsy of one of the masses showed recurrent colon adeno with RAS wild type and pMMR and BRAF V60 mutated. So he started FOLFOXIRI plus Bev.
Post-treatment challenges were as follows.
For which he had a PR, but he had progressive disease 6 months later. He was started on encofabenib and cetuximab, and he remains on this 10 months later in a PR.
Therapeutic decisions for this case study resulted in the following.
But what we're learning is that for those patients who have a good response, their quality of life is really great. They have very few toxicities. When you control them, they do great. And there's no reason, frankly, to stop the treatment. My experience with those tumors is once you stop the treatment, they flare up and they go like crazy if you decide to do that. BRAF V600E mutations are very aggressive drivers of the cancer. And so I favor not stopping the treatment and continuing with it until progression.